because we've just entered a wonderland where we'll meet atropine and the rest of the cholinergic antagonists. Like the agonists, cholinergic antagonists are divided into muscarinic and nicotinic subgroups based on their specific receptor affinities. The nicotinic agonists block cholinergic transmission at the neuromuscular junction, and we discussed these agents briefly in the last video when we learned about the reversal of neuromuscular blockade. This sketch, therefore, will illustrate the drugs that block muscarinic cholinereceptors. Now, before we begin, I just want to warn you that some of the anti-muscarinic characters we'll meet along the way seem a bit different. What? Don't want to go among the mad people? Oh, you can't help that. We're all mad here. Off to Wonderland. Welcome to Wonderland. First, let's introduce our muscarinic antagonists, or in Wonderland, they're known as mouscarinic antagonists. Recall at the parasympathetic port town, we depicted the distinct muscarinic receptor subtypes as 3 motorcycle parking spots, M1, M2, and M3. Well, we're bringing them back, but this time as part of the overflow parking for the atropine tea party. The M1 subtype is found in nerves in the CNS, M2 receptors are located in the myocardium and smooth muscle, and M3 is found on numerous effector organs, including glands, the bladder, and the smooth muscle of the eye. And so it looks like our first guest has arrived, one of the muscarinic antagonists. Muscarinic antagonists cause a reversible blockade at muscarinic receptors, hence our muscarinic friend here is reversing into the muscarinic motorcycle parking spot, thus occupying it. Antimuscarinic agents therefore block the effects of cholinomimetic agents at the muscarinic receptor. Remember that cholinomimetic agents can cause all kinds of moist and sticky muscarinic effects embodied by the mnemonic dumbbells, including diarrhea, urination, meiosis, bronchospasm, bradycardia, lacrimation, and salivation. Again, these muscarinic effects are symbolized by a pair of dumbbells, carried by Tweedledum over here. Also on this muscarinic motorcycle, Tweedledee carries an acetyl-CoA bottle to remind you that muscarinic receptors are normally activated by acetylcholine. Well, looks like they're a little late for the tea party, so they're not allowed in. When you think of the effects of antimuscarinic agents, such as atropine, just think of blocking or reversing dumbbells. Instead, we'll have a whole new array of parasympatholytic symptoms that will emerge, which we'll illustrate in detail around the table. Let's head over there now, as I introduce you to our first muscarinic antagonist, atropine, represented by the star of the tea party, Alice. Have been used for millennia as medicines, poisons, even cosmetics. Atropine is the prototype of these drugs. Atropine and related alkaloids are found in the plant Atropa belladonna, or deadly nightshade, and in Datura stramonium, also known as Jimson weed. Though mostly of historical interest, we sketched in these natural sources of antimuscarinic alkaloids to remind you that they may still be clinically relevant from time to time. For example, a 60-year-old man presents to your ER with blurred vision after cutting plants in his garden. Not only are his eyes super dilated, he's hot and tachycardic. As we'll soon illustrate, this constellation of symptoms is the classic manifestation of atropine poisoning. But in this scenario, antimuscarinic overdose was caused instead by naturally occurring plant alkaloids related to atropine. Uncle Bob got into that Jimson weed again. Well, we'll come back to this patient after we discuss the important antimuscarinic effects caused by atropine. Atropine Alice is a non-selective antagonist of M1, M2, and M3 receptors. So in general, just think of all the actions of the parasympathetic nervous system, now reverse them. Let's start with the clinical effect that gave Atropa belladonna its namesake, mydriasis, or pupillary dilation. Belladonna is Italian for beautiful lady, and during the Renaissance, drops prepared from the belladonna plant were used to dilate women's pupils, an effect that was considered to be attractive. See the big dilated pupil of our next guest here? As he compensates for the outrageous length of this tea party table, the pupillary constrictor muscles depend on muscarinic activation. This activation is blocked by atropine and other related antimuscarinic agents, such as scopolamine and tropicamide, resulting in mydriasis. The second important ocular effect of antimuscarinic drugs is to weaken contraction of the ciliary muscle, also called cycloplegia. This results in the loss of the ability to accommodate or relax the lens for near vision, hence the walrus's gaze is locked through the long-distance scope. Thus, these drugs can be helpful for ophthalmologists who want to perform a dilated exam. The scope also emphasizes the drug scopolamine. See our walrus friend's official Navy uniform that he wore for the occasion? Well, scopolamine is often used to prevent seasickness. And at Sketchy Farm, we'll include a sailor outfit like this one whenever we want to evoke an image of motion sickness or seasickness. Scopolamine is one of the oldest and most effective remedies for seasickness, and it can be administered by injection, orally, or commonly as a transdermal patch. So just think of this scopolamine eye patch. The ability to treat vestibular disorders highlights the ability of many of these antimuscarinic agents to penetrate the blood-brain barrier and block M1 muscarinic receptors in the CNS. Hence the CNS-themed captain's hat. Next, let's introduce the Queen of Hearts, because one of the most important clinical uses of atropine is for the reversal of lethal bradyarrhythmias during advanced cardiac life support. Recall from the parasympathetic port town that M2 muscarinic receptors are expressed at the sinoatrial and atrioventricular nodes. These were represented as two nodal jewels, this time incorporated into the Queen's Heart septor. So while direct innervation to the ventricles is sparse, parasympathetic action on the heart normally decreases heart rate at the SA node and decreases conduction velocity through the AV node. Atropine exerts potent inhibition of the M2 muscarinic receptors at the SA and AV node. Therefore, it can be used to reverse depressed SA or AV nodal activity that can accompany myocardial infarction or shock. Our next guest, the White Rabbit, realizes he's late to the party after looking at his raised heart-shaped watch, which is our symbol for tachycardia, in this case caused by atropine's effects on the SA node. Also notice that this tachycardic White Rabbit is in such a hurry that he shoves over the Queen's guards who stand in his way. At Sketchy Farm, the heart shield is our recurring symbol for heart block, or atrioventricular block. AV block involves a delay or interruption in the transmission of an impulse from the atria to the ventricles through the AV node. This can be caused by numerous cardiac pathologies, including myocardial ischemia or infarction, endocarditis, and intrinsic AV nodal disease. Atropine can be administered IV to acutely reverse heart block in patients with depressed AV nodal conduction who are hemodynamically unstable. In future sketches, we'll run into several drugs that exert negative chronotropic and inotropic effects on the SA and AV nodes, such as beta blockers and calcium channel blockers, used to treat hypertension and arrhythmias. These agents can significantly depress conduction through the AV node, potentially causing heart block. Need to reverse the block and restart those nodes? Atropine's the answer. So both smooth muscle and secretory glands of the airway receive vagal innervation and contain M3 muscarinic receptors. Antimuscarinic agents, therefore, can be used clinically to dilate bronchial airways and reduce secretions. Patients with chronic obstructive pulmonary disease, or COPD, benefit from antimuscarinic bronchodilators. Ipratropium and tiotropium are two synthetic analogs of atropine used as inhalational drugs in COPD. embodied by this catypratiotropilar caterpillar. It's easy to say. Catypratiotropilar. That's pretty great. That'll be the name of my first child. Anyway, the I give up. The Ipratio caterpillar puffs on his antimuscarinic hookah inhaler. Let his blue bloated appearance remind you of the chronic obstructive airway limitation caused by chronic bronchitis, emphysema, or asthma. See those TO smoke rings that trail out of the scene? Tiotropium, in particular, slowly dissociates from the M3 receptor, so it has longer bronchodilator action. It can be given once a day to reduce COPD exacerbations and increase exercise tolerance. Atropine and its analogs also relax smooth muscle of the ureters and bladder wall, slowing voiding. This action is useful for treating overactive bladder caused by spasm from inflammation, surgery, and certain neurological conditions. This will be depicted by the two servers preparing for today's Tea Party festivities, the turtle and ox butler. The ox butler represents oxybutynin, an M3 muscarinic antagonist used to relieve bladder spasm after urologic surgery. It can also be used to reduce involuntary voiding in patients with neurologic disease. Just think of shutting off the flow of the bladder, like this trickling bladder-shaped water dispenser getting shut off by our bovine butler here. The turtle represents tolterodine, another M3 selective antagonist available for use in adults with urinary incontinence. So far, we've focused on reversible inhibition of M3 receptors in smooth muscle and M2 receptors on the heart. But what about those central M1 receptors? Remember that atropine and related antimuscarinic agents can cross the blood-brain barrier, potentially causing some significant central effects. Scopolamine, for instance, penetrates the CNS and acts at vestibular centers to treat motion sickness. Well, it turns out that reduction of central muscarinic transmission may also be useful when managing Parkinson's disease. Above the M1 motorcycle parking, we've erected a sign for the parking center. Center because M1 receptors are expressed in the CNS. Parking because blockade of central M1 receptors can help reduce the tremor and rigidity of Parkinson's disease. A number of centrally acting antimuscarinic agents are available, including benztropine, represented by this Benz car. Another is trihexyphenidyl, embodied by this other anti-muscarinic car here, occupying the last M1 parking spot, ornamented with trihex hexagons. Parkinson's disease is a progressive movement disorder that involves a deficiency of dopaminergic activity in the basal ganglia. So, dopamine. Why do we care about acetylcholine at muscarinic receptors then? Well, it turns out that Parkinsonian tremor and rigidity may result from a relative excess of cholinergic activity in the setting of deficient dopamine activity. So, adding an antimuscarinic agent such as trihexyphenidyl and benztropine can help reduce cholinergic transmission and improve tremor and rigidity. And as a side note, they may in fact improve tremor and rigidity, but they often have little effect on bradykinesia. So to remember tremor and rigidity specifically, notice the tremor of the engine and antenna as the car is left running. Also, that classic Parkinsonian cogwheel rigidity is depicted by the cogwheels incorporated into the parking center sign. And about that pyramid-shaped extra parking cone, it's our recurring sketchy symbol for extrapyramidal symptoms, again for the pyramid-shaped cone. Extrapyramidal symptoms are side effects seen with antipsychotic agents that block dopaminergic transmission. Just like in Parkinson's disease, antipsychotics can cause decreased dopamine transmission at the nigrostriatal tract, producing similar symptoms. In fact, the symptoms can be so similar, there's even a subset of extrapyramidal side effects called drug-induced Parkinsonism, which involves tremor, cogwheel rigidity, and masked facies. Drugs with antimuscarinic effects can help reestablish the dopaminergic-cholinergic balance and treat drug-induced Parkinsonism and other extrapyramidal symptoms such as acute dystonia. Alright, as we wait for the rest of our guests to arrive, I want to briefly discuss the symptoms of anticholinergic toxicity. Treatment with atropine or related antimuscarinic agents directed at one organ system almost always induces undesirable effects in other organ systems. Scopolamine-induced mydriasis and cyclopegia, for example, while useful in ophthalmology, are undesirable side effects when your goal is to treat motion sickness. In fact, the entire spectrum of parasympatholytic effects caused by atropine or other antimuscarinics can manifest in the setting of anticholinergic poisoning or overdose. Remember our 6-year-old Uncle Bob with the blurred vision and tachycardia and fever after excessive Jimson weed exposure? Let's go over some of the classic symptoms you can expect in the setting of anticholinergic poisoning. First of all, remember our Queen of Hearts. Diminished vagal tone at the SA node will lead to tachycardia. Sympathetic cholinergic fibers also innervate sweat glands, and their muscarinic receptors are readily affected by antimuscarinic agents. Therefore, atropine suppresses sweating, leading to hyperthermia. In other words, your patients will be hot as a hare. Besides suppressing sweating, blockade of muscarinic receptors leads to reduced salivary secretion and lacrimation. So on top of hot, dry skin, you've got dry mouth and dry eyes. All in all, you're as dry as a cracker. Remember that walrus who's reminding us that muscarinic blockade causes pupillary dilation or mydriasis and cyclopegia, or the inability to focus on near objects? That is to say, you're blind as a bat. And as a side note, let's say a patient presents with bradycardia after her MI. So you decide to speed up her SA node with some atropine. But now, she complains of severe right-sided eye pain. What you've done is precipitated acute angle closure glaucoma. You see, all this atropine-induced pupillary dilation can cause narrowing of the anterior chamber and diminished outflow of aqueous humor. So what you've done is made her eye as high pressure as a kettle, a perfect addition to the tea party. And look at that dilated pupil on top. And lastly, we've already covered in depth the ability of antimuscarinic agents to cross the blood-brain barrier and exert CNS effects. These adverse effects are especially important to consider when prescribing antimuscarinics, or any agent with anticholinergic toxicity, to elderly patients. Atropine can cause anywhere from mild sedation to amnesia, and even agitation, hallucinations, and coma. In other words, they'll be as mad as a hatter. In conclusion, when you're trying to think of all those antimuscarinic side effects, just close your eyes and imagine the wacky cast of characters at this mad tea party. Your heart will be as fast as the white rabbit, you'll be as hot as a hare, dry as a cracker, blind as a bat, and mad as a hatter. And as urinary retentive as an ox butler guy. Well, you get the picture. Any questions? What's that? Oh, you've gone mad. I'm afraid so. You're entirely bonkers. But I'll tell you a secret. All the best people are.